Use colchicine for gout pain. Gout is the more serious and painful kind of arthritis. This particular medical condition is characterized by swollen and inflamed joints. Gout arises from the buildup of uric acid crystals in the blood, typically brought about by taking in a lot of fat and drinking a lot of alcohol. If untreated, gout could lead to kidney stones and permanent joint and kidney damage. There are various medications available in your local drugstores. One such drug is known as colchicine, which is very useful in reducing the inflammation and pain brought about by gout. Here are some tips on how to use colchicine in treating gout pain. Consult your doctor. The first thing that you would want to do when experiencing acute gout pains is to visit your doctor. Get yourself a thorough examination and ask for prescription drugs. He would usually give colchicines. It is important to always ask for professional help first rather than immediately buying colchicine or some other popular drug even without a valid approval and prescription from your physician. You must always follow what your doctor tells you to do. He is also the one to tell you the appropriate dosage and time interval of taking in the said drug. Take the drug with food. Colchicine requires the intake of food before administering. Like any other prescription drugs, you must consume food prior to taking the said medication. This is done to prevent the adversity of side effects brought about by colchicine. The most common ones are vomiting, abdominal pain, diarrhea and nausea. Colchicine could also have hair loss, nerve irritation, weakness, and anemia as side effects. Do not take colchicines if you are hypersensitive to it. If you have known allergies to the drug, then it is advisable to not take colchicine at all. Administering the said drug into your system would cause serious health problems and severe deterioration of your immune system. Avoid the drug if you have certain illnesses. Do not take colchicine if you are experiencing disorders of the gastrointestinal tract, kidneys, liver, and heart. It is also not advisable to use the drug if you have certain blood disorders. The reason for such is that colchicine could potentially cause adverse reactions within your system as exemplified by its side effects. As much as possible, avoid the drug when you are pregnant. Colchicine could cause the stoppage of cell division, thus taking the said drug would pose a huge risk to your child's growth. If possible, avoid taking any type of medication if pregnant or nursing. Do not drink alcohol when taking in colchicine. Inasmuch as it is a leading cause, Alcohol could reduce the efficiency of the drug, thus prolonging the complications. Alcohol could also aggravate certain side effects such as gastrointestinal discomfort and diarrhea. If the pain does not stop after seemingly plenty of colchicines doses, then it is important to seek medical attention immediately. Your doctor would prescribe other medications, which are much stronger and more compatible to your system.